strike in a row over pay. Their union, the British Medical Association, wants a 35% increase, arguing that qualified doctors could earn more working in a coffee shop. Doctors say they've had a real terms pay cut of 26% in recent years. The Health Secretary, Steve Barclay, says their pay claim is just unaffordable. Our correspondent Yetunde Yusuf is in central London for us with some of those demonstrating. Yetunde, tell us what's happening down there.
As you can see, hundreds of junior doctors have lined the streets behind me. They're joining tens of thousands of junior doctors across the country who are striking for better pay and conditions. And this is set to be the biggest and longest strike action of junior doctors in NHS history. They started at 7 o'clock this morning and they're continuing on until 7 o'clock on Thursday. And of course, this will have a big impact on patient care. There are some more than 40% of people in the medical force are junior doctors, and NHS bosses say that non-urgent and pre-planned operations will be hugely affected, as well as urgent operations, they're saying, as well, are likely to be impacted. So cancer treatment, for example, we know that some 140,000 operations have had to be cancelled over the winter because of a range of strike action. But what are they calling for? Well, it's all about pay and conditions, and the British Medical Association is calling for a 35% increase in wages. They say that it hasn't kept up with inflation over the last 15 years. They've essentially had a pay cut, and junior doctors as well themselves have said that people are leaving the profession to find better paid jobs elsewhere. Now, joining me is Dr. Robert Laurenson, who is co-chair of the Junior Doctors Committee on the British Medical Association. And Robert, people will be wondering why you're not at work and you're here on the picket lines.
Well, there are significant issues that face junior doctors, not least the fact that we've lost 26.1% of our pay over the last 15 years. And the government are signalling that they're going to cut our pay even further. This is a government that imposed a public sector wage freeze on us. They imposed a contract on us, and they imposed conditions on our supposedly independent pay review body. And that's left us with 9,000 doctors short in secondary care and 6,000 GPs short. Junior doctors are the future consultants and GPs of tomorrow. It's so important that we restore our pay, restore our profession, and restore standards in the healthcare system.
But Dr. Robert, people will be wondering, they'll be looking and seeing that doctors are well paid, they might feel, are in good jobs. Is that your reality?
Doctors are paid about £14 an hour in their first year, and even after 10 years, these highly skilled, highly educated and highly talented doctors are only paid about £28 an hour. We're asking for pay restoration to 2008 levels because we don't think any doctor is worth less than they were in 2008, and that just looks like £5 to £10 an hour.
But do you have any sympathy for some of the patients who've had to have their operations cancelled or postponed?
Of course, I absolutely do. And I suspect a lot of these patients will be one of the 7 million who've been waiting for 2 years. And that's a tragedy in of itself. The fact of the matter is, we do not have enough doctors. We do not pay enough to retain them. And there are countries like Australia who literally come here and say, we want to steal your doctors.
OK, thank you, Dr. Robert Laurenson. Of course, the demands that the British Medical Association are calling for, the Health Secretary, Steve Barclay, says is completely unaffordable. He said he's tried to call the strike action off by getting the unions around the table, but the unions have said that it's not a credible offer. But in the meantime, patients at the moment are told that if you need urgent care, call 111. If you need emergency care, call 999. And if you have a planned operation, turn up unless you've been told otherwise. But as for the junior doctors here, they'll be making a lot of noise in an attempt to get their voices heard for the politicians behind me.
OK, Yetunde in central London, thank you.